A torn ear lobule, it cannot repair by itself or it cannot heal by itself. Why this happens is, this happens because of this occurrence is over a period of time. It stretches over a period of time, and there is a skin lining which is there inside the tear. And when the skin lining is there, these cannot stick to themselves, and thereby they cannot heal by themselves. But there is a situation where you can have a cut ear because of, let's say, something accidentally injuring your ear lobule because of a knife or because of a nail or anything. So here, because of the cut which has been recent, these things can heal on its own, but not at your torn ear lobule. These things take time to develop, and they have a piece of skin inside, and hence they have to be repaired. A ear piercing can be treated both surgically as well as non-surgically. So let's talk about the non-surgical methods. These are most simpler and they don't involve any cutting open. Now the non-surgical methods are to use an acid in the form of a bud. We wet the bud with the acid. Typically the acid used is a trichloroacetic acid, and what happens is we wet the ear piercing with the acid, and the acid, what happens, what it does is it actually creates a raw area there, and then subsequently by healing the opening closes. So this is how the non-surgical methods of ear lobule piercings are treated. Now, the coming to the surgery, you have uh, methods where the tissues are paired and they are sewn with fine plastic surgery sutures, and subsequently these heal over a period of time, and the piercing can be done at a later date or later stage. Another popular question which is posed to us plastic surgeons is, can the ear lobule which is torn, can it be glued? Yes, this can be glued. Now there is a reason why people ask this question. Now sometimes most of our patients come to us just maybe a week before a major occasion or a wedding or whatever it is. Now the time is very less when they actually come for seeking earlobe repair. So this is the time when we tell the patients that you can actually wear your earrings, and we glue the earrings and we put a plaster, transparent adhesive plaster, uh, which is placed behind the ear, and the ear piercings can be done through the transparent membrane, which we actually stick to the patient's own ear lobule. So the glue is actually making the surface, one surface of the ear lobule, which comes together, and the surface which is behind is actually covered with a transparent membrane, and the jewelry is actually going through the transparent membrane, and they can actually go for functions with the jewelry on without having to resort to any surgery. Now the question asked is, how do you repair the ear lobule? There are two methods to repair a torn ear lobule. One is the classic and a conventional method of repairing a torn ear lobule is by tearing the margins of the torn ear lobule and suturing the edges with very fine plastic surgery sutures. So this is what is being done very conventionally, and it's a standard method. But a lot of patients expect to wear their jewelry or their earrings right after the surgery. And this is possible through the second method, which I'm going to elaborate, and that's called the Purdue flap. Now, the Purdue flap, what exactly happens is a piece of tissue is turned around and sutured to the ear, creating the opening. So this happens on the top part of the ear lobule, and the bottom part, which is actually torn, is repaired by a conventional suture. So you have the flap which acts like a hammock, which supports the ear ring, so that it doesn't prevent it from sagging or tearing in the future. So this is the method which we employ for most of our patients because patients want to attend um, functions or marriages or any other occasions, and they would like to wear their jewelry. So this method allows us to ask them to wear their jewelry almost immediately after 1 week after the surgery. The question is, how can the enlarged ear lobule be reduced in size? Yes, plastic surgery addresses this issue where some of our patients have a condition called as mega ear lobule, or the lobule can be abnormally large. So there are techniques where you can reduce the size of the ear lobule and suturing the removing the portion of the excess ear lobule and suturing back the remaining lobule in place without causing much scarring. Yes, these are techniques used commonly and where patients seek corrective measures for correcting their enlarged ear lobule. A lot of our patients ask, can this be painful, the ear lobule surgery? No, ear lobule surgery, when it's done prior to the repair, we anesthetized the affected area with injections of xylocaine, which completely numbs that area. And these injections also are very, very painless. We use the thinnest possible needles, and possibly the pain is very, very minimized because of the finer needles that are used. So once the anesthesia action starts kicking in, the procedure can be done, and it's almost like there is absolutely no pain when the procedure is being done. The standard healing time after a surgery is around 5 to 7 days. So within 5 to 7 days, the healing would take place, and we would remove the sutures in 5 to 7 days of time. A cost of a ear lobule surgery. Now, typically one ear lobule repair, one-sided repair, would cost you between 12 and 15,000 rupees. Now, when this is combined with both the sides, we would charge around 25,000 of Indian rupees. So, a single ear lobule repair 12,000, and both ear lobules would cost you around 25,000 rupees.